So a 52-year-old man with high cholesterol, blood pressure normal okay, overweight to maybe obese, pre-diabetic with an abnormal stress test, ischemia on stress test. And so when we start to plan treatment, whether it's nutrition or other modalities, we're not just treating labels. We're not treating a person with hyperlipidemia or a pre-diabetic or whatever. We're treating the pathophysiology. Hello everyone, and welcome to another session of the MHW Clinical Rounds. We're going to discuss a patient who had pretty significant cholesterol improvement in a very short period of time. Ashley, tell us about this patient.
This gentleman came in to see us, 52-year-old male, had a standing history of cholesterol problems, some issue with the sugar, pre-diabetic, a little bit issue with the weight, and some bradycardia, which is a slow heart rate. He kind of came here with his wife, and the goal was to just try to make some changes lifestyle-wise because his wife was very familiar with doing nutritional stuff, and so he was just kind of, well, I'll give this a try mentality, which was great. It was a great opportunity for him. When he came in, he didn't have any complaints, no symptoms. He was kind of hesitant, even thinking whether or not it would be beneficial or not, but he was willing to give it a try.
So he had high cholesterol, family history of high cholesterol, a pre-diabetic. Did you say he was hypertensive also?
No hypertension, a slight weight issue.
What was his BMI?
I don't remember his BMI, but his original weight was 210.
210. Okay, he's about 60. So BMI maybe 30-ish?
I believe so.
Was he taking any medications?
He was not on any medication, supplemental stuff.
Okay. So they really didn't want to go the medication route. So pre-diabetic, basically someone like this would give them metformin or a statin drug, ARB, those three, maybe a fourth drug. Blood pressure's okay. If he wants to lose weight, maybe get one of those new GLP-1 agonists.
I think I even recall he even mentioned that, at a point of time, Ben had suggested to him multiple times about doing, pharmacological interventions and stuff like that. He definitely fit into the paradigm of being metabolic disorder problem and maybe just across the board. He definitely was open to other possibilities because he definitely did not want to do medications. So first set of labs we did, the part that really just definitely stood out is, his cholesterol was 248, his LDL was 156. He had some inflammation markers above the normal. We look for a particle here. It's called LPPLA2, which is suggestive of arterial inflammation. That was abnormal, which is very important because when we actually did diagnostic testing, he had some abnormal testing that correlated with this too. We're doing a pulse score, which is a study that looks at other fibrogen markers as well as inflammation that puts someone at a risk for a coronary syndrome. His score was above normal. It was 10.03.
Yeah. And that's like a heart attack, acute coronary syndrome, or stroke even. Okay. So you had a 10%, 1 in 10%. Okay.
Correct. And so he did the detox with his wife, completely raw. We did integrate a natural supplement called Lipid Balance, kind of in the middle of this, because his level was so high. But going back to his diagnostics, he did have an abnormal stress test, and that was the reason why we were kind of aggressive about trying to get the cholesterol under control. His stress test showed that he had ischemia, which is suggestive that there could be a mismatch in perfusion on what we saw during the stress with the EKG response. So that kind of correlated with the cholesterol level as well as the LP-PLA2 marker being inflammatory, possibly with arterial. So that really kind of painted a picture that this gentleman was definitely dealing with some vascular problems that we definitely need to help him get things under control.
So a 52-year-old man with high cholesterol, blood pressure normal okay, overweight to maybe obese, pre-diabetic with an abnormal stress test, ischemia on stress test. He had an increased plaque score, plaque 2, which again, as you point out, is of increased vascular inflammation. We also like to think of that as an indication of an increased chance of having unstable plaque. And then the pulse score was 10%. Again, that pulse score, as you pointed out, it looks at a number of different biomarkers, several of which are inflammatory biomarkers, which measures the amount of cell injury and repair. And then there's some metabolic things such as HDL is in there, and A1C is one of those things that contributes to it. So it looks at the metabolic profile, and it gives you a score. And based on that score, it tells you, how old your blood vessels are. but your percent chance of having a cardiac event within 5 years. So that's good to know, because if that is high, let us know we need to do something pretty quickly. Did we get an echocardiogram? Was it EF normal?
Yes, we did. Echocardiogram was normal, but he did show that he did have some degree of diastolic dysfunction, stiffening of the heart. He did have a little bit of mild left ventricular hypertrophy as well, a little bit of enlargement of the left ventricle.
So the heart was squeezing normally, but it was stiff, but it's also thick. With a stiff, thick heart, you think hypertrophy. Now, the heart's a muscle, as you know, and if you can think of skeletal muscles, when the hypertrophy, just think of a bodybuilder who's lifting weights, the muscles are very thick. And oftentimes they're stiff because they may not stretch out because the muscles are very tense. So a thick heart muscle, you would think, is a lot of muscle, but thickness that we see on the echocardiogram may not all be muscle tissue. Sometimes that thickness is due to inflammation. Now, he's pre-diabetic. People who are pre-diabetic have high insulin levels because we have insulin resistance. And insulin behaves like a growth hormone, and it can cause smooth muscle, blood vessel walls, but also thickening of the heart muscle. So even though he didn't have high blood pressure, because you tend to say, okay, well, high blood pressure causes the heart muscle to be thickened, but also pre-diabetes with high insulin levels behaves like a growth hormone. That's why mothers who have gestational diabetes have big babies, because they have an insulin resistance, and a lot of insulin's floating around is acting like a growth hormone to the babies. But you also have increased inflammation. You know it in the blood vessels, which can also be going on in the heart muscle. So inflammation is not thickening the muscle, but it's more scarring, swelling. So that thickening we see on ultrasound, is that muscle, or is that swelling, or is that scarring? We have to differentiate. Now sometimes look at the EKG. If there's high voltage on the EKG, electrical voltage, then it's more muscle. If the voltage is lower, normal to low, it's not proportional to the thickening. A lot of that thickening is scarring. And so when we start to plan treatment, whether it's nutrition or other modalities, we're not just treating labels. We're not treating a person with hyperlipidemia or pre-diabetic or whatever. We're treating the pathophysiology.
But again, going back to like we discussed, I mean, his ejection fraction looked good. So that was comforting, knowing that even though he had some positive ischemic on the stress test. So he went on the detox. He was very committed. He followed the program exactly the way we had hoped. Within 4 weeks, the results for his total cholesterol went from a 248 pre to a 156 post. His LDL went from a 157 to a 99. His triglyceride originally pre was 353. Post was 122. His applied A2 marker, which is the arterial inflammation marker we're talking about, went from a 168, which is abnormal, to a 123, which was normal.
Wow.
CRP level was a 2.5, went only marginally down, was a 2.4, but still showing there's definitely improvement in most of all of his markers. His pulse score went from a 10.03 for 5-year risk of coronary artery problems to a 4.12, which is within the normal limits, and his weight dropped down to a 190. But the most important part was that he felt so good and he felt so empowered. I remember his comment to me was, I've never seen my cholesterol number this low before. But what's also important is that a drug didn't solve this problem. It was all him. And he recognized that, and that was wonderful to see that he knew that he was in control, that he took care of this, and he was able to bring his number down to that level just doing lifestyle changes and dietary stuff.
You know, that's amazing. In a minute, we're going to look at the graphics because we graph those out so the audience can see that, because I think a picture's worth 1,000 words. But I like your other comments because it's really important, and I think needs to be highlighted because, as you said, he felt empowered. He never saw his cholesterol levels that low, and it was based on what he did. Now, oftentimes people say, well, this raw detox diet is extreme, it's crazy, and I like a little chicken every now and then, blah, blah, blah. And I think we missed the point there because we use it as an intervention, and it has multiple effects. One, the numbers improve. So there's some say, well, what's the long-term effect? How is it going to be in 20 years or 5 years? Is he going to stick with it? We don't have the answers to all those questions right now. We do know that if he sticks with it, it's going to be better and stay better. We have data showing that. But the point I want to emphasize here is the thing that you mentioned, is that he felt so much better. He felt better physiologically, but he also felt better psychologically. And he felt empowered. And that's an important thing. That's not a trivial thing, because let's say he goes out and eats a rib sandwich and gets sick 2 weeks later. I mean, that's not a good thing. But what we have established here, if we implant it in his mind and giving him the experiential knowledge that he's capable of taking care of his health. Now, will we have to get more support down the road, et cetera? Yes, we have lots of programs for that. We can talk about that in another setting. But I do want people to understand that the benefit of this is, A, he's going to get better. He did get better. He's feeling better. But he also knows there's a mental aspect that we like to drive, and he's empowered. And that's what we like to do with our patients, empower them to do better. There's a lot of things that, we can come and help them do, et cetera. But the first thing we need to do is have someone who is engaged, who's empowered, who knows what to do, and who knows this work, and they're confident. Once that is established, then the sky's the limit. So I think that's an important point to make.
One example I always like to share with folks is that whenever we talk about making these type of lifestyle changes, we know it's going to be a difficult journey because it's a change, because we're kind of swimming against standard norms here in our country. But I also go back and reflect on when we first were recommended to wear seatbelts. When everyone was starting to wear a seatbelt for the first time, everyone had to get used to the idea, I have to wear a seatbelt every time I get in the car. And prior to that, no one really thought anything about it.
That's right.
And then it became a norm. So now when we jump in the car, it doesn't even reflect whether or not we're doing something that was foreign at one point. Well, I always bring this up with people and I start talking to them. And then I ask them, well, why do you wear your seatbelt now? It's a safety thing.
That's right.
It becomes a standard norm at some point in time.
Yeah, now that is exactly right. That's an excellent point, because I remember before we didn't have to wear seatbelts, and I think I remember cars that didn't have seatbelts.
Exactly.
I was a little kid. So I'm dating myself, but anyway, ancient times, we weren't riding horses and buggies to school, Camille. But no, that's a great point. I like that seatbelt analogy because it was something that was foreign, not something you do automatically.
Yeah, automatically.
And that's why the nutritional component is, it's something you do automatically, because once it's firmly set in your mind, I don't eat that anymore, then you know how to make those changes regardless of what circumstance you're in.
Exactly.
And we have programs to help people with that. Why don't we take a look at the data and kind of point that out, which you sort of illustrated. So I want to start with the LDL cholesterol. As you said, it started at 157 and went down to 99. This is in a little less than 4 weeks here. HDL cholesterol typically goes down on this regimen, and people say, well, is that a bad thing? But, you need less HDL cholesterol, so therefore it doesn't, have to stay as high. So the neighborhood is safer, so you need fewer police, is an analogy I like to use. Triglyceride went from 353 to 122. If you go back up and look at the triglyceride to HDL ratio, the baseline triglyceride to HDL ratio was almost 10 to 1. And it went down from 10 to 1 to about 3.5 to 1. That's actually pretty good. And then the plaque 2, as you said, went down from 168 to 123. The HSCRP went down barely, but still a certain amount. And the pulse score went down tremendously. So even though he has a ways to go, he's improved drastically. His weight loss was about 20 pounds, so it's about a 10% weight loss. So I think the key is he had a major improvement. It took a very short period of time, less than 4 weeks, which underscores that this intervention can be used without medication. A lot of people say, well, he's a pre-diabetic, he's got this, he's got all these risk factors. This intervention works fast. It's fast and effective. And so we have lots of patients come in with elevated blood pressures, and when we prescribe this intervention, it brings it down as fast or faster than medications. Any final comments?
No, the only thing I can think of is that, I hope that everyone who's watching this, that they realize that there always is a solution to a problem, and that it's just a matter of maybe rethinking the way we approach our problem. Might be a way of looking at it. Unfortunately, we have brought into a society that we don't think much about our food, and we should really think about our food, because that's truly the foundation of everything. This is a prime example of once someone commits to it, they apply themselves, you get this great outcome in a very short time frame, which then just fuels the endeavor even more. So
that's it. Can't put it any better than that. Well, I hope you got something out of this. And as always, if you have any questions about anything we said here, or if there's any comments, please share it in the comment box. We'll try to address any and all questions you have. And of course, some of your questions may spark new topics for other sessions. So any ideas or thoughts you have, we're open-minded. Until next time, take care.